Dr. Cohen, now lots of patients keep telling us keep telling, to the doctor and say, look, it's my kid's first teeth, and they're a little crooked, so what? Let's not even go to a dentist. They're all coming out. I mean, especially now, economy is, it's tough for all of us, and there is no doubt about it, tell us what risk a parent here is going to engage in with his child, neglecting to work on their first baby teeth.
One of the most important things that people need to understand is that the mouth is a gateway to the body. We in dental school learned a lot of different medical things because we're a lot of times the ones that can actually recognize disease processes before even the physicians are involved. We're kind of mouth physicians, but we know a lot about the body, and it's because, number one, the mouth is not the cleanest place in the world. There's a lot of bacteria and all kinds of other things in there. And if the mouth is not healthy, cavities or gum tissue problems, gum disease, those kind of things, it can cause a gateway for infection to get into the body, even in little kids. There are a lot of problems that can develop from kids that have, call it septicemia, where they get a lot of bacteria in their blood system. It's really important that all parts of your body are healthy because they're all interrelated. You can't just ignore one part and think everything else is going to be fine.
Well, let me ask you, aren't children and elder people more weak, more, I can't pronounce the word, and they're more able to get an infection versus, about 20, 30, everything is strong. Wouldn't a kid get easier a flu and an elder one gets easier flu? Somewhere in the middle, we're pretty strong, I guess, no?
Well, absolutely, and that's why they always say the young kids get the flu shots and the older people get the flu shots first. Your body does, when you're young and when you age, there's not as much strength to it. It's real important that we keep the youngsters healthy because, they're growing. And if they're not healthy while they're growing, they won't be healthy when they're adults either because they didn't grow properly. So it's really important for their future that they are as healthy as possible.
So what should a mom do? Let's just take, for all purpose, newborn. What should be the cycle mom should take the kid through?
Most dentists expect that the kids should be seen by a dentist by age 2 when they have all their baby teeth in. However, there's some new studies that have been going on, and now a lot of dentists are actually having kids come in when they're 8, 10, 12 months old, once they start getting their first teeth. And what happens is that they have what's called a lap exam, where the parent just holds them back and the dentist kind of looks at them. It does a few things. Number one, it gets the child much more comfortable around the dental office. Fear is one of the biggest reasons that people don't get dental treatment. And really, in today's age, with all the high tech and all the advancements in pain control, there's no reason why anyone should really fear the dentist. But it's real important that it's not put off. If you wait till a kid's 5 or 6 or 7 years old before they see a dentist, there could have been a tremendous amount of infection that's been in that person's body, or they could have lost baby teeth early, which could have caused a tremendous amount of problems orthodontically later on, a lot of functional problems. It just all kind of snowballs. It's a domino, and if you don't hit the dominoes right, they all fall.
Of course. Now, let's assume a mom is pretty good at bringing the kid to the general dentist or to the children dentist. Would she still on her own go and visit an orthodontist like you, or is she most likely be well advised by the general dentist and say, look, it's time to check out an ortho because there's something going on?
Most dentists are really pretty good as far as referring a patient over when they see things. However, there's really no reason why we can't see a patient without a referral. And in fact, a lot of our patients do come in because they said, my next door neighbor said it was time for Johnny to have his teeth looked at, so I thought it was time for Mary to have her teeth looked at. You can't really recognize problems unless you look. And I definitely am not one of those kind of people that just because a person comes in the door, they need treatment. It's only what's going to be best for that person. And really, if we do treat a person early on, it's because their problem is so severe that if it's not treated, it's going to get worse and worse and worse and worse.
Yeah, I've heard that you're the dentist. You see an awful lots of children on what you call an observation. You know, they come in, they're okay, you're not sure which way it will develop. You might make some small recommendations, even some very small treatment, I guess, exists there. Sure. And then just keep, again, avoiding that a major treatment is needed, which then no matter what costs more money and takes longer and all that stuff.
Exactly. And then there's some instances that we can see a person that, because their jaw structure is not right, we can actually easily correct their jaw structure in 8-10 months, and they might not even need a full-blown orthodontic treatment because we preempted a big problem. So it's really important to have the kids looked at, and especially those that have any things that they don't quite do right, kids that are thumb or finger habit kids that have speech defects, kids that have open bites to where their front teeth won't come together. Those are the ones that if you let them go, it only gets worse. Form follows function, and if a person's not functioning properly because their jaws aren't in the right place, then they're going to grow and grow and grow in the wrong direction, and then it becomes very, very difficult, if not impossible, to fix later on.
So it looks to me like it is probably well worth it to spend the time, effort, and perhaps money, I don't know, but in order to go to a specialist and make sure that it is okay. Eliminate. If it's all okay, fine. He will say so. If small things can be fixed, it's like with a car, if you can, right, fix a small, tiny thing, you won't be stranded out in the desert. Thanks a lot.
That's why you have your oil changed every 3,000 or 5,000 miles so that you don't have all those big problems.
Right. Exactly. And that's why, of course, there exist specialists in the first place.
That's correct.
So that you go for that, particular mortality to that specialist. Wonderful.
That's correct.
All right.